How do you choose which radiation therapy? Is it one of those things like if you go to an M&M store and they only sell M&Ms, they're going to walk out with M&Ms? Or is it more the fact that you treat somebody with that form of radiation because that's what you believe in? Or is it that there's different types of radiation that really work better with some people than others? And do you think we're heading in the direction vis-a-vis breast cancer where we look at the genetics of the cancers and soon we'll be able to say that this is a true radiosensitive cancer, this is the one that needs radiation, or this one is radio insensitive and this one really needs to have surgery, or this one really is such a benign cancer, it's one of those that's such a low proliferating one that we can just ignore it altogether?
I think the take-home message today in regards to that question and everything we're talking about, from screening to diagnosis to treatment, is the communication you have with your physician who's diagnosing you, the physician who's your primary care physician, and really when it comes to treatment, a multidisciplinary approach to the treatment of prostate cancer, meeting with a surgeon, meeting with a radiation oncologist, meeting with a medical oncologist, and as you said, taking the time to do your research and not automatically jumping into the scare of it and getting a treatment without knowing all the information. All I want is for anyone in our office to have all the information available and to make an informed decision about what's best for them. So we'll take into account the PSA, we'll take into account how many cores of that biopsy are involved, how aggressive those cores are, and also the motivations of the patient in wanting to maintain certain quality of life features. So not every treatment is good for every patient, and that's part of the communication process to say, this is your Gleason score, this is your PSA, this is how potentially your prostate cancer is, and these are the options available. In the lowest risk, you have the most options available, and one of those options is to do nothing. But this is what brachytherapy is, this is what external beam is, this is what the radical prostatectomy are. And we want to make you feel comfortable as part of the decision-making process. So, brachytherapy is not great for everyone. External beam is not convenient for everyone, but certain subgroups of patients can benefit from either, and certain, you have to tease out which is best for which patient. So again, communication with the physician and, making yourself part of the decision-making process can help really gear you towards making a decision that you're most comfortable with, and ultimately that's what we all want on this panel.